Zembrace Symtouch Pen Injector is a medication used to treat migraines and cluster headaches. It helps to relieve pain, sensitivity to light or sound, nausea, and vomiting associated with migraines and headaches. Prompt treatment with Zembrace Symtouch Pen Injector can help you get back to your normal routine and may reduce the need for other pain medications. It does not prevent future migraines or headaches, nor does it reduce how often you may get a headache. Zembrace Symtouch Pen Injector belongs to a group of drugs called triptans, which affect certain natural chemicals in the brain and may also block pain pathways. Before using Zembrace Symtouch Pen Injector, make sure to read the patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist for guidance. This medication can be injected using a syringe/needle, an auto-injector, or a needle-free device. Make sure to learn all preparation and usage instructions in the product package. If anything is unclear, consult your doctor or pharmacist. It's important to understand the correct technique for injection and how to properly dispose of needles, syringes, auto-injectors, needle-free devices, and unused medication. Inject the medication just below the skin as soon as the symptoms of your migraine or headache appear. Clean the injection site with rubbing alcohol before each dose with a syringe and needle or an auto-injector. If using a needle-free device, make sure your skin is clean and dry before injecting. Do not inject this medication directly into a vein, or into a muscle, and never inject it through clothing. If there is no improvement in your symptoms, do not take any more doses of this medication before talking to your doctor. If your symptoms are only partly relieved, or if your headache comes back, you may use a second injection after 1 hour or as directed by your doctor. Do not use more than 12 mg in a 24-hour period, and do not reuse the syringe or the needle-free device. Check the instructions on your auto-injector device to see if it may be reused. If your symptoms are only partly relieved or your headache returns 2 hours after the injection, you may switch to sumatriptan taken by mouth instead of using a second injection. You may take sumatriptan by mouth every 2 hours if needed, up to a maximum of 100 mg of tablets in a 24-hour period. If you have never taken this medication before and you have risk factors for heart disease, you may need to be monitored for rare but serious side effects when you take the first dose. Your doctor may ask you to take the first dose in the office. The dosage is based on your medical condition and response to treatment. If you are using drugs for migraine attacks on 10 or more days each month, do not use medications more often or for longer than directed. Tell your doctor if you need to use this medication more often, or if the medication is not working as well, or if your headaches get worse. Now let's talk about the possible side effects of using the Zembrace Symtouch Pen Injector. You may experience pain, swelling, bleeding, or bruising at the injection site. You may also feel flushing, tingling, weakness, drowsiness, or dizziness. These side effects are generally not serious, but it's important to tell your doctor if they persist or worsen. It's also important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks. Many people who use this medication do not experience serious side effects. It's possible that this medication may raise your blood pressure, so it's important to monitor your blood pressure regularly and inform your doctor if it is high. Sumatriptan, the active ingredient in the Zembrace Symtouch Pen Injector, may cause chest, jaw, or neck tightness, pain, or pressure. While these side effects are usually not serious, it's important to seek medical help immediately if you experience symptoms that resemble those of a heart attack, such as chest pain, shortness of breath, or unusual sweating. Other serious side effects may include fast or irregular heartbeat, fainting, severe stomach pain, signs of a stroke, changes in vision, confusion, blue fingers, cold sensations in the hands or feet, hearing changes, mental or mood changes, seizures, or symptoms of serotonin syndrome/toxicity. If you experience any of these symptoms, seek medical help right away. While a serious allergic reaction to this drug is rare, it's important to seek immediate medical help if you notice symptoms such as rash, swelling, dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you experience any serious side effects or have concerns about the medication, it's important to discuss them with your healthcare provider. Before using the Zembrace Symtouch Pen Injector, it's important to let your doctor know if you are allergic to sumatriptan or other triptan drugs, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so it's essential to talk to your pharmacist about any concerns. It's also crucial to inform your doctor about your medical history before using this medication, especially if you have any blood circulation problems, certain types of headaches, heart problems, liver disease, seizure, stroke, or mini-stroke. Certain conditions such as high blood pressure, high cholesterol, diabetes, family history of heart disease, overweight, smoking, being postmenopausal, for women, or being over 40 years old, for men, can increase your risk for heart problems, so be sure to discuss these with your doctor. If you are at high risk for heart disease, your doctor may want to check your heart before prescribing Zembrace Symtouch Pen Injector. This medication can make you feel dizzy or drowsy, and consuming alcohol or marijuana can intensify these effects. Therefore, it's important to avoid driving, using machinery, or other activities that require alertness until you feel safe to do so. Limiting alcoholic beverages and discussing marijuana use with your doctor is also advisable. As age increases, the risk of heart disease, liver disease, and high blood pressure also increases, so older adults may be more sensitive to the side effects of this medication. If you are pregnant, it's important to use this medication only when clearly needed and discuss the risks and benefits with your doctor. Additionally, if you are breastfeeding, consult your doctor before using the Zembrace Symtouch Pen Injector. It's important to be aware of potential drug interactions when using Zembrace Symtouch Pen Injector. Taking MAO inhibitors with this medication can cause a serious and possibly fatal interaction, so be sure to avoid taking MAO inhibitors during treatment with this medication. Additionally, the risk of serotonin syndrome/toxicity may increase if you are also taking other drugs that increase serotonin, such as certain antidepressants or street drugs. If you take any ergotamine medication or other triptan drugs, you will need to separate your sumatriptan dose from your dose of these other medications to lessen the chance of serious side effects. Be sure to consult your doctor for specific guidance on when to start or stop taking this medication and how long you should wait between doses of these drugs. Remember to keep a list of all the products you use and share it with your doctor and pharmacist. And as always, do not start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much of Zembrace Symtouch and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or contact your local poison control center at 1-800-222-1222. Canadian residents can also call their provincial poison control center for assistance. It's important not to share this medication with others. Certain foods, beverages, or food additives such as red wine, cheese, chocolate, and monosodium glutamate, as well as some lifestyle patterns like irregular eating or sleeping habits and stress, may trigger a migraine headache. Avoiding these triggers may help decrease the frequency of migraine headaches. It's best to consult your doctor for more details. Your doctor may also recommend lab and/or medical tests, such as blood pressure checks, while you are using this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. Only use the Zembrace Symtouch Pen Injector when you experience a migraine, as instructed by your doctor. It should not be used regularly and should not be taken at a higher dose or more frequently than prescribed by your doctor. When it comes to storing Zembrace Symtouch Pen Injector, it's important to follow the specific instructions for the brand you have. Make sure to keep it away from children and pets, and don't store it in the bathroom. When it's expired or no longer needed, be sure to properly dispose of it by consulting your pharmacist or local waste disposal company. And remember, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.